Thanks, Pam. It's an honor to be here this afternoon. I'm excited to talk with everybody. So, first, a little background about our organization. We're a true cooperative of 44 rural hospitals. One of my favorite facts is when we formed in 1979, they took dairy cooperative bylaws, crossed out farmer, wrote in hospital, and hit the ground running. So, if that's not rural Wisconsin, I'm not sure what is. We're unique when it comes to rural healthcare organizations because we're structured as a cooperative, not an association. So, we primarily provide shared services to rural health hospitals to help strengthen rural healthcare delivery. So very similar than some of the agricultural cooperatives that help strengthen your farm enterprises. We're also unique in that we have half system affiliated hospitals and half independently owned and operated hospitals. So we have some Gunderson Bellin hospitals, HSHS hospitals, Marshfield, Aspirus, and SSM, and then those independently owned and operated hospitals, which is unique across the country that we see a high level of coordination and collaboration between those two entities and really helps to strengthen the rural healthcare ecosystem in Wisconsin and elevate the idea that rural hospitals are stronger together rather than competing with one another. And the vast majority of our hospitals are critical access hospitals, which means that they're 25 beds or less and targeted at 72-hour stays or less. So that gives you an idea of the kind of services that they're providing to their communities. So I wanted to start with kind of a high level overlook of what does the rural healthcare landscape look like in Wisconsin going into 2024. And I don't have the fancy charts of the ag economist, so I think I still have something to offer in this space. So the good is that Wisconsin has seen a lot of preservation of rural healthcare access. When we look at other portions of the United States, specifically the southeast portion of the United States, we've seen these rashes of rural hospital closures and whole counties or multiple counties that don't have access to healthcare services. And Wisconsin has been able to preserve many of its rural hospitals and clinics and ensure healthcare delivery in rural communities, which is very positive. We also rank incredibly well in terms of the quality of the healthcare that we're delivering in rural communities. 77% of Wisconsin hospitals received either a 4- or 5-star quality rating from the Center on Medicaid and Medicare Services, which is a national quality ranking metric. And that was the 4th highest percentage of 5-star rated hospitals in any state. So rural Wisconsin hospitals are incredibly high quality institutions, which I think is always important to impress upon individuals who sometimes think that you have to travel to an urban area to get good care. And one other thing I wanted to highlight in the good section after hearing this morning's kind of forecast is that many of our hospitals are growing their mental health services as quickly as they can. And we know that farmer mental health is a really important topic in Wisconsin. We've seen some great collaborations between extension and CAP agencies and local farm bureaus and healthcare providers to help strengthen the network of providers that are available to care for farm families. So if that's a challenge you're facing, please seek out those resources in your community. But we do have a number of challenging things facing the healthcare field in Wisconsin when we look ahead to 2024. So we have workforce shortages now in our organizations, and we know that they are only getting more challenging as we look out to 2035 and beyond. And the difference between other fields and healthcare when we think about workforce shortages is it's coupled with increased demand, right? Because we're seeing these retirees aging out of the workforce, which means that they also are aging into higher utilization of healthcare services. So this coupled phenomenon of decreased supply of healthcare workers with increased demand for healthcare services is really challenging for rural hospitals to overcome. We're also seeing a number of cost challenges. So the cost of labor and the cost of supplies have increased dramatically for rural hospitals, over 10% since 2019. And we don't have the same ability to control the revenues coming into our organizations that many industries have. Specifically in rural healthcare, some of our hospitals have payer mixes that are 60% or more from Medicare and Medicaid. So those government payer sources don't necessarily keep up with inflation. And so that leads to an economic picture that's really tight for rural hospitals. And we know that we're seeing more hospitals operating with negative operating margins and a lot of financial pressures that are going to be crunching our field in the next year. So how are our hospitals thinking about improving rural livability? How does healthcare tie into this topic? What we know is that only 20% of health outcomes are attributed to clinical care. So while healthcare access is super important, it is a minority of what determines whether or not an individual is able to be healthy. A much larger share of people's health outcomes can be attributed to the community and where they live and the economic conditions within that community. So items like housing, transportation, education are really important to our hospitals because they know if those community conditions are not impacted, they are not able to improve health outcomes for the patients that they serve. So all of our hospitals provide clinical care. The vast majority of them help individuals who they serve meet health-related social needs. So this is things like when an individual comes in, they screen for food insecurity and help to refer them to a food pantry if that's a need an individual has, because we know that food access is linked with health outcomes. But our hospitals are also starting to think more upstream. So how can they address social determinants of health and change community conditions within their communities to lead to better health outcomes? And what this is really doing is taking the focus of healthcare off of the individual person and broadening it to think about the community and systemic conditions that are impacting health. Because we know that individuals' health does not exist within a vacuum, right? Exists within the frame of reference of their community and the systems that shape their community. So, why do our hospitals have this approach to their interactions with their community? The answer to that is because hospitals and communities are really inextricably connected. And if your hospital is struggling, oftentimes it indicates your community is struggling, and vice versa. If your community is struggling, it often indicates that your hospital is struggling. So, what the research tells us is that hospital closure occurs disproportionately in locations with higher socioeconomic disadvantage. And additionally, hospital closure is associated with areas of higher unemployment rates and higher uninsurance. So, if hospitals are in communities that have struggling economies, they're more likely to be impacted. And part of healthcare access and retaining healthcare access is ensuring that your community has a strong economy. On the flip side of this, hospitals are really positive economic drivers for rural communities. They're large employers. They have a number of economic spillover effects, including things that you wouldn't think of, like increasing local retail sales and increasing the number of small retail establishments within communities and the amount of sales tax that's generated within those communities. And on the flip side, when hospitals close, we see much broader economic effects than only the loss of the specific hospital jobs and the loss of healthcare access in the community. We see that closure impacting things such as construction, information, sales, and finance professions. So things that you don't traditionally associate with hospital closure. So, one of the ways that our hospitals are thinking about how they can impact their rural communities that ties in very well with what Matt was talking about in terms of rural livability is acting as anchor institutions. And hospitals are definitely not the only anchor institution, but they're one of a number of anchor institutions in rural communities that have what's often referred to as sticky capital. So they can't just get up and move, right? The Memorial Hospital of Lafayette County in Darlington isn't going to say, you know what, times are tough here, we're going to Arizona. So they have a vested interest in making sure that their communities are thriving and that they're doing a business in a way that supports their communities thriving. Other anchor institutions that we often think of are schools, both K-12 and higher education, local governments, and sometimes churches and libraries too. So, what is an anchor institution strategy? This is a way that our hospitals think about their role as anchor institutions in order to have a larger economic impact locally. That includes hiring, purchasing, investing, and my own bonus category of place based investments when they're doing construction projects. So, hiring often looks like grow your own strategies, right? What we know in rural healthcare is that we cannot rely on recruiting the healthcare professionals that are going to be the workforce of the future from outside of our community and winning them to come in. We have to think about creating our own talent pipelines locally for everything from CNAs up to physicians. And part of this also is thinking about childcare infrastructure within our communities because we can have the best thought out workforce development plans. And if there is no one to care for children so that people can go to work, those workforce development strategies are not effective. Um, Purchasing looks like supporting local businesses and local producers within your community whenever and however you're able. And rural communities, obviously, in healthcare, you don't always have, for example, a glove manufacturer right next door, but you often do have farmers and food producers that you're able to support with local purchases, Main Street businesses, local contractors, and just thinking innovatively about how you're expending hospital resources to have a larger purchasing impact locally. One example, one of our hospitals did a purchasing scan and figured out they were buying all of their bread off of essentially the Cisco truck and instead have now shifted that and are buying all of their bread from a Main Street bakery. So those little changes add up over time and help recirculate more money in the local economy. And finally, investing, right? So it's important for hospitals to have some sort of investment portfolio, like most large institutions, to ensure they can weather economic shocks, cybersecurity attacks, and other challenging times that come their way. But they can shift how they invest those investment portfolios to have a larger local economic impact. So we've seen hospitals support housing projects, workforce development projects, and overall relocalize some of their investment dollars to spur the local economy. And finally, we've had some hospitals think really innovatively about how their construction projects impact the local economy. So, oftentimes, when you're doing a big building project, it's much easier to buy potentially a piece of former farmland, go to the edge of town, and have a blank canvas to build your space. And we've seen some hospitals take on some really tricky downtown development projects because they wanted to anchor that downtown. They wanted to drive foot traffic. They wanted to support other local businesses, and they wanted to help be a revitalization and spark of energy in their downtown. Um, and I think that's an underutilized strategy, if you will, for some anchor institutions in rural communities. There are also some intangible roles of anchor institutions, right? So this is the stuff that you can't necessarily quantify, but has an impact on rural livability. So oftentimes our hospitals have the ability to act as a convener or a leader within their rural communities and pull people together to have hard conversations and solve issues and challenges that arise. One example, one of our hospitals was able to pull together a group of 20 different community leaders and business owners to go to the municipality and say, hey, we all know housing is a challenge here. What is our community's plan to deal with that? They were able to work with the municipality to get a housing study completed and work on recruiting developers because they acted as this convener around an issue. And while it sounds kind of squishy, I think it's a really important role for anchor institutions to play. We've also seen our hospitals advocate and educate on pressing issues within their community to leaders. Housing is a prime example of this. Workforce housing has become incredibly challenging in many of our communities, as Matt's slide showed, where you saw that huge share of homes owned by individuals that do not live in the communities. And by advocating to local leaders about the importance of workforce housing for the continuum of healthcare delivery in their communities, they've been able to shift policies and create positive change in the housing stock within their communities. And finally, leveraging existing non-financial assets. So we've had hospitals that have utilized their grant riders to partner with other local community organizations and take some of those soft skills that they have within their organization and bring in external resources to solve community problems. Hospitals have also done this with Broadband Task Force, using some of their IT knowledge to help drive county broadband planning efforts. And what this all really leads up to is capacity, right? We talk about this all the time in economic development. It's capacity for rural communities to tackle challenges that they have in front of them and find solutions that are grassroots, community driven, and fit their own communities. So, what have we learned from some of this work in healthcare? It's that we do not believe in staying in your lane because the conditions of a community impact the hospital's ability to be financially solvent, to recruit staff, to continue to provide healthcare access, and to improve health outcomes of individuals within their communities. This is my contact information. I'm really happy to follow up with anyone. Thank you.